Hello, my name is Sebastian Diebel, a current fourth-year student at NHRC. The title of my presentation is Utilization of Teleurology in Northern Ontario in an Acute Emergency During the COVID-19 Global Pandemic, a Case Report. I have no conflicts of interest to declare. Northern Ontario is a unique geographic area that possesses a significant rural population. There is also a chronic shortage of physicians in this area. One potential solution that may exist is the implementation of telemedicine. This case study will demonstrate how a teleurologist was effectively able to manage a patient during the COVID-19 global pandemic. In this case study, an 80-year-old man presented to the emergency department and was found to have acute on chronic urinary retention. After a battery of tests, it was decided that management would involve a catheterization for 6 weeks. The patient would be followed up via telehealth. During the 6-week period, the patient's catheter became obstructed. However, the global pandemic had just been declared and the patient was hesitant to leave his house. As a result, he phoned the teleurologist, who was able to advise the patient on how to unblock the catheter. The patient was then followed up the following day via telemedicine. As a result, the patient never had to leave his rural community during the pandemic. This case study demonstrates a quality of care that a specialist was able to provide to a patient who had an acute on chronic episode. It is interesting to point out that when the patient needed help the most, the person who was able to help was 775 kilometers away. This case study provides further evidence to suggest that telemedicine, and specifically teleurology, has proven to be a pragmatic approach to allow efficient screening and adequate protection to patients during the COVID-19 pandemic. That being said, there are still limitations, and it is important to select the appropriate patient.